We are recording this presentation so that others who didn't have a chance to join during this time can view this, or you can go back to this presentation later. A couple of things we wanted to bring out today is related to some of the updates to bus guidance, some of the guidance related to testing, and updates to guidance around levels. Veronica, did you want to start from here?
Yeah, so we have some changes in our bus guidance. Most of it are things that you're all familiar with. Everyone on the bus has to wear a mask. Some of the basic sanitation stuff. The written document will have some stuff on windows, keeping them open at least 2 to 3 inches in the front and back. And if you do open it more than that, to open it more than halfway. And also to help control the flow in and out of the bus and the foot traffic, it is best to load the bus from back to front and unload from front to back to kind of reduce that foot traffic and the chance of people kind of interacting with people that aren't in their nearby seats. And consider assigning seats and making sure that you have that seating plan and that seating chart. If possible, limit the occupancy to 50% capacity on the buses, but we do understand that sometimes this isn't possible. And the document also has some guidance as well on how to protect staff, which PPE is recommended for bus drivers and attendants. And if they're unvaccinated or unable to wear the advanced PPE, to make sure that you keep the row behind the driver empty. And to help you kind of figure out a good seating layout, we'll also have an Excel bus calculation tool that will tell you the average number of close contacts by seat. I can put in a screenshot of what that would look like in the chat, but basically just you put a 1 wherever you want a student to seat, and it'll tell you the average number of close contacts. So some things that might be kind of surprising is if you want to have a bench that has, say, 3 people on it, like you have 3 siblings, if you do that and skip a row, that actually would result in fewer average close contacts than if you had 2 people at every single row, for example. The bigger bus guidance is going to be on the quarantine recommendations. That's where the big changes are. So if I could go to the next slide. Previously, we'd recommended 2 rows in front and as well as some additional rows, but now we're limiting it to just that immediate bench that infectious student is on, the bench in front, and the bench immediately behind that infectious student. Particularly if it's a window or a middle seat that the infectious student is sitting in. If the infectious student is in the aisle seat, then you'd also want to quarantine someone that's sitting directly across the aisle from that person. Now, this is our minimum recommendation. If you feel like people that are on this bus are higher risk for whatever reason, because let's say the infectious student didn't wear a mask, or you're not certain what the seating assignments are, or it was a really long bus ride that's jam-packed full of students, you are welcome to quarantine more people if you feel like it's a higher risk. But this is our minimum requirement, and everything else is optional as far as quarantine goes on buses. Any questions related to busing? All right, then I'll hand it over to Mark for testing.
Get my mic open here so I can talk a little bit. So we'll talk a little bit about testing in terms of some common questions that are coming up with some of the testing pilots, as well as some of the issues that we're going to do with kind of our testing protocol that we want to introduce in a little bit more detail here. But we are recommending that schools, especially if they don't have any testing capacity, to look at one of several options to get testing capacity within their district and within each building. The testing program through the Department of Health with the Bill and Melinda Gates Foundation, um, my understanding with that is they are getting a significant amount of dollar support from the federal government, and there's not a set number of schools that are able to participate or districts that are able to participate. They're able to add more districts. There may be a wait time for that, but it is something that's available, I believe, to all school districts and even smaller schools if you want to consider that as an option. We do also have a process around antigen testing. There's a toolkit that we developed for that in terms of everything that's needed to get started with that in your building or in your district. Takes you through the process of getting a CLIA waiver, talks about the reporting, talks about how to order the test kits and training and what needs to happen there. There is a standing order that can be used for antigen test kits, using Dr. Velasquez as the ordering provider for that if that's needed with your district. So there's really a lot of options for getting those testing capabilities in your district. Could I get the next slide? We've had a lot of questions with these options of what's kind of the best test to use, or when do I use PCR, or when do I use antigen? And I wanted to talk about some of those considerations. There's not necessarily a right or wrong answer, but there are some considerations that would push you to using one test or another. PCR is the most sensitive test, but it also has a turnaround time, and that can be a disadvantage at times, with what you're trying to accomplish in terms of getting kids back in as quickly as possible if they don't have COVID. Antigen testing, because it's a little bit less sensitive, if we're more than 7 days after onset of symptoms, at that point you would want to use a PCR test, because you're going to have the possibility of more false negatives as the viral load drops. Antigen testing also has some limitations where you're going to see some false negatives at the early stage of the illness, on onset day 1 usually, where the viral load is not high enough to register a positive test. In this setting, PCR should show a positive test. So those are some of the disadvantages with antigen testing, but we have some really strong positives with that in the sense of being able to get results, within a half hour, and to really be able to test a large number of people and get an idea of what's happening in a classroom or another setting fairly quickly. One of the situations that you're going to see in students who are returning to school who have testing done in the community is that many of them are going to come in with an antigen test result. And right now, because of the issue with false negatives in that first 24 hours, the question of that happening, we are requiring that if they're coming in with an antigen test, they need 2 antigen tests, 2 negatives, separated by 24 hours, as kind of the test-based criteria to return to school if they've had Class A or B symptoms. So if you have antigen testing capability in your building, then it's very easy if they come in with that antigen test result that they had in the community with going to Rite Aid or Walgreens or a provider's office. You can quickly just have them test in the building with a second antigen test. That's likely going to be 24 hours or more after the first, and would meet that criteria. And if they're negative, they can just go back to their classroom. That would be the option there. And that's why, that's one of the reasons why we want to encourage schools to have both options. Certainly they could do a PCR. You could send the child home to get a PCR test, or do a PCR within the testing pilot from Curative. But that's going to be 2 to 3 days before you get a result of that, and that student's going to have to be out of school for those 2 or 3 days. So there's some advantages to having both. There are times, let's go back one slide. I think there's just one or two things I just want to make sure that I'm touching base on. There are a lot of times where there's a consideration where you want to use both at the same time. So if you're going to look at a testing strategy and you're testing people who are symptomatic, I would say start with a antigen test. If you have a positive result at that point, we can consider that to be COVID. If it's negative, you can do a curative test at that point and send that out. That's still going to be a 2 or 3 day time period before you get the results. So that might not be a bad idea on the weekend. If you're testing on Friday, you should get that result by Monday. But if you have a student who you don't have a high index of suspicion, and you believe that they're going to be able to come back, the next day, and a parent is going to bring them in for testing, you can just as easily just have them go home for that day, come back the next day a little bit early, and get a second antigen test, and then that child could return to school. So you really have a lot of options in terms of how you want to utilize those two different testing platforms. I want to stop here for a short pause and just see if there's any questions that schools who have testing pilots have around the two different test options that we have right now, or if there's any experiences from some of the schools who are utilizing these, if there's anything that I haven't really mentioned that you think is really valuable to share. I'll just leave a pause for a couple of seconds. Any questions or anything that's useful to share at this point? Okay, let's go on to that next slide then. So the other big piece that we want to really talk about is using testing in schools as a mitigation measure for minimizing quarantine. At this point, up to this point, we really haven't had mitigation measures that could change quarantine. It didn't matter, if everyone, if someone was subject to quarantine, in a classroom because you had 2 cases, everyone was wearing a mask, they still quarantine. Distancing, they still quarantine. Vaccination has been one mitigation measure that can minimize that. Past infection is another. But this is an active step that you and the school have control over. And so this is what we're putting forward, is that we can use testing as a mitigation measure for what I call generalized quarantine. And this is kind of the quarantine that comes about when you hit a particular threshold in terms of number of positive individuals. So this would be, if you have, in level 1, if you have 2 cases in a classroom and you would normally quarantine the classroom, this is a way that those people who are quarantined just because they're in the classroom, they're not a close contact, this is a way that those children could stay in school. This is not a way that someone who is an identified close contact can return to school. A close contact is going to be quarantined regardless of any testing that's done. But we are offering this option because it does have some benefits. We have not seen a lot of transmission in settings where we've quarantined classes. With testing that's been done outside of that, we haven't seen a lot of transmission, and it does result in a lot of people getting quarantined, especially if we're looking at secondary schools, who, let's say you're in a level 2 where one case is going to quarantine a whole classroom. If that happens in a school where you have 6 periods, well, that could be, 70 plus students who are likely quarantined with the numbers that we've had. And with physical distancing being reduced as an option after spring break, then that would be even more kids who are potentially subject to quarantine. So this is a way to reduce, that impact on students, especially when the risk is very low. And it's also something that's going to decrease the workload for COVID staff, because you're not necessarily having to manage all the quarantine issues related to that many students. This is certainly an option for schools to consider, but the choice on this is really up to the parent on this. So if you have hit a quarantine threshold in a classroom, 2 cases in level 1, then you would just communicate to those parents and say that we're going to have to quarantine this classroom, but you have the option to stay in the classroom by enrolling in this testing protocol. And as long as you're not symptomatic and as long as you're not an identified close contact, then you could move forward, with this testing protocol and stay in school. So let's go for that next slide. So going into a little bit more detail on this, certainly this is directed by the parents. It's their choice whether to enroll their child or not in this protocol. But basically what we're doing with this is that there's a baseline test that's done. Once you're enrolling all the students in, what we've kind of piloted this in a couple of different settings, with athletics and with a classroom at this point, to kind of understand, what are the potential kinks and areas that we need guidance for. And in this setting, those kids come to school a little bit early. They're tested, before school starts. Especially if we're using antigen testing on this, we can get everyone tested, within a half hour, and then they go, provided they have a negative test result, they go, to their first class. So we have a baseline test, and then I say 1 to 3 additional tests depending on schedule and some defined intervals. And I leave it a little bit vague there because sometimes when we identify that second case in a classroom, maybe that last time that second case in the classroom was on Thursday, but we don't identify it till Tuesday. We don't know about that. And let's say we enroll in the testing protocol and we get those kids tested on Wednesday. They're already, about, 5 days into that. So if they get tested, on as a baseline, and then, your school is on a 10-day quarantine option, then you're going to probably get tested, closer to, to day 10-ish. 8, 9, and 10. So it may be 2, but if you're on a 14-day quarantine, or if you're identifying that early, or we're dealing with athletics where we might test a little bit more frequently, then you might have additional tests done. But those would be kind of defined intervals, with working with our education team. And as long as they're testing and they're testing negative, they can still participate in the class. They're not quarantined in any sense. They can participate in other activities or athletics as long as they don't have any symptoms, they haven't tested positive, and that they're not a close contact of another lab confirmed case. And what I mean by this is sometimes you're going to go into this testing protocol, and you have 2 cases in a classroom, and you go through that testing protocol, and then we have a 3rd case identified. Someone tests positive 5 days into that testing protocol. Well, that new case, that 3rd case, may have some close contacts in that classroom. And because they're close contacts, they would then be quarantined, even though they had enrolled in that testing protocol. So I hope that makes sense. But that's kind of what we're looking at for this testing protocol. I think it's going to be really successful in terms of keeping students in school, when the risk is extremely low, and it's going to provide us, some good options to really understand if we're seeing asymptomatic transmission, within our schools. I don't know if I have another slide after this. If I don't, let's just check if there's another. Nope. Let's go back one and just see if there's any questions from anyone. And I did say we were kind of running through this process, with the district to kind of explore how this was working. So we've done this with a secondary classroom, and we've done this, with an athletic team, with Mead. I don't know if Ruth or Kara, if you guys want to kind of touch base on your experiences with this, or what's your thoughts on this process and the utility of it.
This is Ruth. I can speak to that. I think I'm getting a lot of feedback here, but we had a very positive response to this. We had an athletic team that we were able to isolate close contacts and then test the others, and they were able to continue to participate, continue to play, and finish their season. Parents were super supportive and super willing to be involved in it when it allowed their kids to continue to participate. We also had a classroom with 2 positive cases, and every parent in that class chose the testing option in order for their kids to still be able to attend. And it went really well. We did the MyNex. It was pretty quick and easy process. Have done some great work. Carrie's got some great sign up work done into making the sign up for parents really easy. And the testing is quick. And once we know that it's probably a negative test, it's fast, and we continue to watch it. But the kids can get off to school, and if we need to call them back if for some reason that turned positive right at the end of the test, we could do that. But it's been a really well received thing with our parents, and a pretty easy process to do once you get the reporting part of it just kind of tied up.
Ruth, do you have any comments? I know we've talked about this, with our team, but comments or suggestions for schools that are looking at this in terms of how to communicate with parents and, the permission to test and some of those issues, and how you guys have dealt with that?
We did send out kind of just a blanket PR kind of thing through our district that testing was a potential ahead, and that was probably, I don't know how much people really were aware of that until it actually happened. As far as the sign up, what we have figured out is our policy that we put into place required that a parent was going to be present with every test. And we quickly are realizing we probably need to change that and put out a different kind of consent form that the parent would always be there for the first test, and then they could probably for a 90-day consent allow us to test we would probably do a verbal call or some kind of communication with the parent, but not require a parent to be there for every test after that. That's just a little burdensome. Although every parent so far has been willing to come in and do the 2 or 3 tests that we've required.
Okay, thank you for that. If Ruth or Carrie, if you guys have any other comments on this, I want to open it up to other districts on questions on this, and kind of the utility of this, how this would be implemented, and just want to open this up because we do want to make this as an option that's available to all districts to kind of involve parents in that testing process, but also to kind of mitigate the risk of having students still in class by providing that testing.
I'm not sure, Mark, if you mentioned about the fact that Kira had done from the health department, did all the initial training and gave us a lot of the good documents and that kind of stuff to get started. So that was very helpful.
And she has since kind of improved on that process. They have a whole testing, I don't want to say a kit, but just, that there's a whole process. They've got videos on this. They've really, brought everything together so that it's as painless as a process to get started with this. It doesn't require that nurses do the testing for this. It can be other people who are trained, with the process. But I want to strongly encourage schools that haven't got any antigen testing or have applied with the state to get a PCR test to consider that, because I think that's going to be a very useful option. One other thing that I do want to mention I've talked about this with a few slides. We have a more detailed document that's about 3 or 4 pages long that has some FAQs attached to it to talk about, these issues around testing that we are going through the final review stages of and should be available to send out, during the break. But if there's no other questions, I think we have Lisa coming up, kind of talking about kind of modifications with the guidance around levels.
All right, hi everybody. So we've made some minor changes to the levels associated with schools. And so what we've done is sort of tried to do a bit more of a proportional response rather than just having a set number of cases. And so we're hoping that this will lead to a little bit less in terms of potentially schools closing down, but also just providing additional options for the schools to use to aid in reducing the number of kids that are potentially quarantined. So before, we used to have 3 cases that would move you to a level 2 and then also 10%. We've changed it into a percentage. We wanted to keep this level 2 sort of the same for the most part, but we want it because we do feel that, if there is starting to be an uptick, moving into level 2 isn't easy, but it is definitely necessary to just keep a really close eye on the school and the number of cases. These are all still just associated with cases that are infectious while in school. So it is still extremely important to continue to do your contact tracing and remove any students that might become a case before they are infectious while in school. The level 3, this is again just primary for elementary schools. We've moved it a little bit different. We've allowed elementary schools to have a little bit bigger of a buffer for moving into a level 3, just due to the fact that they're a lot more cohorted. And so we feel that we want to, we don't want them to close down with a smaller number of cases. And with them being cohorted, I think that there's a better or an easier way to keep track of the students in small pods. So with that, we've moved it from, I think it was 2%, we've moved it all the way up to 3% and still about 20% of the classrooms. But again, we will keep level 3 as closing down for a full 14 days. For high school and middle school and high school, we've moved it to 1% of the population. That's still the same, and 10% of the classrooms. But we did up it to a 2% and 20%. So we didn't move too much on that. And again, the reason is due to the makeup of the students within that group. And the majority of high school and middle schools within Spokane County are in a non-cohort setting. So there is a lot of movement and a lot of interaction within these students. So we feel that this is still an okay level to go. And not really decrease too much, but we have added in a couple other mitigation steps to be able to hopefully not quarantine larger groups of classrooms. The illness absenteeisms have not changed at all. Those will still remain the same. We do feel that there might be a little bit more use of this, especially when students do return for full time, so 5 days a week, just due to the fact that they'll be at school more consistently. And then it's still the same of considering closing the building down with one school compartment or some staff transmission or school-based transmission with staff. So these are some of the new changes. Again, we're not modifying if they are infectious in school or not. We still are maintaining and focusing on the students that are and staff that are infectious while at school. Can I go to the next slide, please? Okay, so that just a little bit more of an option based on the levels. So again, it's just if there are two cases within a classroom for just level 1, which is the standardized level everybody is in for the most part, you can close a classroom with 2 cases that are infectious while it's infectious and at school, or we're adding in this testing option. And so we want to be able to do that for the best of our ability. We would like to have some sort of baseline once you are notified of a case. Mark spoke a little bit about some of the complications that might come up with that and some of the ways around it in terms of when you're notified of that case. And we want to try to keep this all the way up to 4 students if possible. Or if there is known transmission occurring within the classroom, then we would not continue to maintain the testing protocol. We would just move to close down the classroom. If parents or students do not want to participate in testing protocols, then they should be excused for the full quarantine time of the classroom and only be able to participate in school in an online format. So it's not a do or die situation. We want to make sure that the online option is still available for those students that just do not want to partake in testing, cannot partake in testing, or just have a really difficult time with testing. So it's not something that we want to force everybody to do. It's just another option to allow students to not have to completely go away if there is no known transmission within the school. And then the other thing that we have added is that we've noticed there's been an uptick in illness-related absenteeism rates. And so if we start to see within just a classroom 40% of an absenteeism rate due to illness for 3 consecutive days, we would either like to enroll that classroom into the testing protocol or talk with us and go ahead and move to potentially closing down that classroom, just to ensure that that is not COVID-related illness or the illness isn't related to COVID-19, and we're just not understanding the transmission that might be occurring within a classroom setting. Any questions around level 1? And I'm sorry, I don't have the chat open, so for some reason my chat is being very complicated. But do you have any questions around level 1? All right, let's go ahead and go on to level 2. Next slide, please. So for level 2, it is again the same sort of thing. We feel very comfortable that, moving into a level 2 is still very doable for most schools. And we have maintained that 1 case in the classroom. But again, we want to be able to continue to provide that testing. And I think if we do enough testing, that will show if there is transmission occurring within the classroom. And this will maintain a lot of classrooms moving forward without having to close. But again, same thing, all of those other ideas and methods are still set in place. If we have 4 positive cases within a classroom and you are enrolled in testing, that's when we would move to closing the classroom. Again, staffers or parents or students that do not want to partake do not have to partake in testing, but they will have to be excused for the full quarantine time from that classroom. Next is we've reduced the illness absenteeism rate from 40% to 20% for 3 consecutive days. This is again just making sure that we are really ensuring that these classrooms that have a really high absenteeism rate are being addressed, and we're ensuring that it is not related to COVID-19 in general. Any questions related to level 2? All right, level 3. Level 3 is the easiest slide we have. Level 3, again, quarantine all students. We will just close down the school for 14 days. Generally, we're not going to quarantine the whole building, but we would quarantine, again, close contacts and quarantine classrooms that are definitely having illness-related issues and or COVID-19 cases that are present within there. So, and again, with this level 3 movement, we still want food to be able to be provided to the students by, via drive-through. Online education will still occur. We're just really hoping not to see a ton of level 3s moving into the springtime here, and that's our ultimate goal. But if you do have to move to a level 3, please do reach out to us. I think that, we'll be there to help you guys work through the issues and hopefully come up with some other aspects around moving to a level 3. All right, if anybody has any questions around level 3, go ahead and ask them. Otherwise, go to the next slide and it will be turned over to Victoria. Any questions? All right, thank you, everybody.
So I just wanted to speak to some of the updated guidance that's been put out. Recently, Governor Inslee updated the guidance related to physical distancing. He stated that school districts are permitted but not required to reduce the distance between students in the classroom from 6 to 3 feet under specific circumstances. So essentially, he's reducing this requirement for students within a classroom to distance 6 feet to 3 feet, as long as they're meeting some of these things, and transmission is relatively low or at least moderate. So between students in the classrooms in elementary schools specifically, students should be at least 3 feet apart. This used to be 6 feet. So this should allow for more students to be able to fit within a classroom. And in middle and high school, students should be at least 3 feet apart in areas of low, moderate, or substantial community transmission. So with middle and high schools, meaning that when there's significant community transmission, you should be considering keeping students distant at least 6 feet apart. So under the following settings, it would be best to maintain 6 feet of distance. So in the circumstance that cohorting is not possible, you should maintain 6 feet rather than 3 feet, or during times when there is high community transmission. So for example, when Spokane County COVID case rates exceed 200 cases per 100,000 of the population over a 14-day period, or when test positivity is greater than 10%. So as of right now, the last that I checked, the data is showing that we're at about 157 out of 100,000. So we're just below this high community transmission rate. We're looking ahead towards spring break and some other things that could potentially push us at or above 200, so we're monitoring this closely. Other settings that would indicate that we should be maintaining 6 feet of distance are instances when you have other adults, other staff and teachers interacting with each other, or maintaining that 6 feet of distance between adults and students. Also, instances when masks can't be worn, such as with students that can't wear masks when students are eating, such as during meal times. Also, during activities when there's increased exhalation, such as singing, shouting, band practice, or physical education, or for those reasons students aren't wearing a mask. Try to move those activities outdoors or to large, well-ventilated spaces whenever possible to also mitigate this. And then also, we should be maintaining 6 feet of distance in common areas such as lobbies, auditoriums, and other places where there's a large group of students or students and staff gathering. So I just wanted to also mention some additional prevention measures, some strategies that we can be keeping in mind when we're introducing this reduced physical distancing between students in order to help keep COVID transmission low. So in general, we should be trying to use cohorting whenever possible and limiting contact between cohorts. So for example, having students be cohorted, and within that cohort, the students could be seated 3 feet apart from each other, but between different cohorts, trying to maintain that 6 feet of distance, especially in areas of substantial and high levels of community transmission. Also, try to remove any non-essential furniture and change classroom layouts to maximize distance between students. So if there's other furniture apart from student desks, try to remove those or try to distance those a little bit further apart to minimize spread as well. Try to face desks within a classroom in the same direction. You can also eliminate or decrease non-essential in-person interactions among teachers and staff during meetings, lunches, and other situations that could lead to adult transmission. Adopt some visitor policies where you would limit non-essential visitors, volunteers, and activities involving external groups, other organizations outside of the school setting, especially with people that are not from the local area. In general, we should be requiring all visitors to wear masks and physically distance from others as much as possible. Then, as Veronica mentioned in the beginning, there's a lot we can do with transportation and creating distance between children on school buses, between children and bus drivers, as well as opening windows to improve ventilation. Another prevention strategy is staggering scheduling. So that can include things like arrival and drop-off times, or staggering locations where students are arriving and being dropped off, changing that by times and locations by cohort. I just want to pause here and ask if anyone has any questions about this change to 3 feet, or if anybody has any additional prevention strategies they've been using.
Hello, Victoria. This is Mr. Arlt. Can I ask a quick question?
Go ahead.
I think it was on your first slide. You mentioned 6 feet if cohorting is not possible, but then you said best. I would say that most secondary situations are not cohorting, but can you talk a little bit more about that, please? And if my question makes sense.
Yes, I think I understand what you're getting at. It's not a requirement that you maintain 6 feet of distance when cohorting is not possible.
Okay.
These are essentially some of the additional settings under which you should be considering 6 feet, if you can, understanding that these middle schools and high schools may or may not be able to cohort. But for example, in elementary schools, if they're not able to cohort, they might want to consider 3 feet, sort of depending on how many students are in the classroom and what other risk mitigation factors they're using.
Okay, thank you.
But just to also clarify, the high community transmission, these bullet points here, those are at the moment kind of, these are stated as somewhat of a requirement by the governor. So we don't at this moment have too much leeway here. We're looking into it, but essentially, if we're going above 200 cases per 100,000 in the population over 14 days, or seeing a greater than 10% test positivity, this is when we would be asking folks to maintain 6 feet of distancing regardless, or be looking at some other mitigation factors.
Victoria, I have a quick question about the 3 foot. If we have a positive case and they're 3 foot in distance, are we going back to having to quarantine the close contacts all the way around that student, diagonal, front, back?
Yes, I'll skip ahead to a couple slides for visual here, and then I'll go back just to address the question. But essentially, if you have students that are within that 3 feet of distancing from each other, they'd be considered close contacts. So say the student in the top left corner was positive, you would be looking at quarantining those students to the right of and to the side of and behind that student because they're within that 3 feet. So they'd be close contacts by definition there. So that is kind of the risk with bringing students a bit closer together. You're able to, on the positive side, probably fit more students within the classroom and bring more students to in-person learning. But then if there is a positive student, there's that increased number of students that would be considered close contacts. And I'll talk in a little bit about what we can do to sort of mitigate that. In the chat, I see a comment with the new guidance. If we have 2 staff members who'd eaten together only 6 feet apart, would we not consider this an exposure if one staff member is positive and then not quarantine in this case? I think I would consider that other staff member to be a close contact because they're eating, they're talking together, they're only 6 feet apart. So I'd be considering that respiratory droplets could travel that distance. Mark or Lisa, did you want to speak to how testing might come into play there? Or is it pretty cut and dry?
Can you
You know,
repeat? Oh, there's
go
Mark.
ahead.
Just
No,
to
go
repeat,
ahead, Mark.
say you
Sorry.
have one positive staff member who's eaten with another staff member. They were both obviously not wearing masks and they're only about 6 feet apart. Would we consider that other staff member to be a close contact and quarantine them?
So, I mean, this really comes down to that definition that we're using for a close contact, 6 feet or less and 15 minutes or more. And I know the hard part is that, well, people will say, oh, I was just sitting, 5 to 6 feet away from a person. Well, is it 5 or is it 6? Is it under 6 feet? And that becomes a judgment call for you guys as contact tracers. I understand that. But that staff member wouldn't be able to test out. Hopefully, if that staff member is fully vaccinated, then they're not going to be quarantinable as long as they don't have any symptoms. So that's another reason, certainly, to kind of strongly encourage vaccinations with staff. Did that answer the question?
Yeah, thank you, Mark. This is Meredith from SPS. And I just asked, that's what we have been doing is quarantining in those situations. But there was that slide that said, where masks can't be worn, keep 6 feet apart. And so I just got confused. I didn't know if we were changing that or not. So I think you did answer the question. It sounds like it stays the same.
Yep. The close contact definition is not changing with this.
Okay, thank you.
And then I'll just add to that, most of the guidance related to lunchrooms and meal times is also not changing. We're still recommending that folks stay spaced at least 6 feet apart. If you can cohort or group together those students, that would also be a good scenario. Encouraging them to pull their masks up if they're not actively eating and they're just talking with their friends, and eliminating or decreasing any non-essential in-person interactions during that lunch period. So not too much has changed there with relation to lunch. Most of what has changed is related to within the classroom. Does anyone have any other questions related to the lunchroom?
This is just a general question on 3 feet. When we're measuring 3 feet, is that from like nose to nose 3 feet, or is that 3 feet between desks? How does that 3 feet actually measure?
The best description I've been given is from edge of the desk to edge of the desk.
Thanks.
And
That's helpful.
Sandy, if you're on, if you want to talk a little bit more about that, that would be great. Are you on, Sandy? I'm sorry.
Yes, I'm here. Yeah, we would recommend that you go from the outside edge of one desk to the next, or chair to desk, if it's like a single unit. If it's a separate table, or say like a bench in a science room, and you've got a stool or a chair, you'd want to measure from as if that chair were occupied, and then go 3 feet to the next piece of furniture. Because I think one of the things that students do a lot is they don't just sit upright in their chair, they lean over their desk. And so they tend to end up being closer anyways. So that would be a little bit more conservative to go with the outside, of the furniture, but gives a little bit extra protection too. So that's what we would recommend.
Okay, I'll move ahead, but feel free to interrupt if folks have other questions. As Mark mentioned, we're not changing this definition of what a close contact is. It's still anyone who has been within 6 feet for 15 cumulative minutes or longer over a 24-hour period with someone who has been confirmed COVID positive in the last 14 days. So you would still quarantine those close contacts. You would also still quarantine anyone with symptoms until their symptoms improve. You would only release them if they could produce a negative test result and a doctor's note indicating a non-COVID diagnosis. And you'd also quarantine any student that is falling, again, still fitting that close contact definition, essentially meaning that they've been within 6 feet of another contact. So, as I mentioned, if you're bringing these students closer together and they're sitting 3 feet apart as opposed to 6 feet, while this does increase the number of students in the classroom, which is a positive, you have more students in-person learning. This also increases the risk, meaning the number of students who may potentially need to quarantine because they would be close contacts sitting only 3 feet apart from a COVID positive. So this does bring back the adjacent student rule and some of those considerations. Any questions there before I get into some seating suggestions that may help mitigate this? Okay, just wanted to bring up 2 potential options. I'm sure there's many others. These are just 2 that we thought of would be a good way to help mitigate the number of students that would need to quarantine in the case of a COVID positive in a classroom where students are as close as 3 feet from each other. So in general, as much as possible, try to face students forward. This helps mitigate spread. But this option displayed on the slide is essentially putting the students in mini cohorts within the classroom. So you could have 4 students that are sitting only 3 feet apart from each other, but they're 6 feet away from the next little group of 4. So if you had one COVID positive student, say in the top left corner, the close contacts would be those 3 students that are within 3 feet of that student. And you may not necessarily need to quarantine those other students because they wouldn't be identified as close contacts. So distancing, again, not the only reason why you would quarantine someone, but specifically if we're looking at the close contact definition and who would you need to quarantine, in this scenario, you'd only be needing to quarantine 3 students that are close to that positive. Any questions about this suggestion before I move on to the second one? Okay. The second option would be, again, facing students forward, but arranging the room in columns where students are 3 feet away from the person directly in front of or directly behind them, but 6 feet away from the person to the left or to the right of them. So this reduces the number of close contacts even further. in the case that you had, say, the top left corner student was sick, you would only need to quarantine 1 or 2 students, those students being the ones directly in front of or directly behind them, because those would be the only ones within 3 feet of that student and fitting that close contact definition for quarantine. You could apply similar logic if you were to arrange the students in rows, where in each row students were only 3 feet from each other, but the students behind and in front of them would be 6 feet apart from them. So just another seating option that you could implement if you wanted to bring students close together, 3 feet together, but you didn't want to have to quarantine too many students in the case of a COVID positive. Do we have any questions about these suggestions, 3 feet in general, or any other suggestions folks have thought of when trying to arrange a classroom? Okay, did anyone have any questions about anything else throughout the presentation, or anything come up? Any specific cases you wanted to bring up at this time? We're just at about time, so I'll leave it open with some dead air for a couple of seconds, but if not, we can close out this session. Mark, Lisa, Veronica, did we have any final announcements or final things we wanted to mention?
Yeah, we are trying extremely hard to get these documents finalized and approved for pushing them out to all of the COVID teams. We're hoping to at least get you a draft document by tomorrow. Can't guarantee that though, but we are really hoping to get this approved and moving forward as soon as possible. But as everybody knows, there's always those little steps that we still need to get approval on. But if you don't have it by tomorrow, Friday, I am absolutely certain you will have it prior to returning from spring break, if your spring break starts tomorrow, or I'm sorry, on next week. So if anybody has any questions related to any of the updated guidance, please do feel free to reach out, and we are happy to discuss any of the changes or try to help with some of the questions that might arise, along with that 3 feet guidance too. That is entertaining, plus all of the phase 3 guidance that is causing some issues. Hopefully the next COVID training will try to address some of the performance art ideas or phase 3 guidance, just to kind of help clarify some of the issues that we're seeing pop up from the different questions that we're getting.